Hello, everyone. This is Dr. Shevchenko from Smiles by the Sea Family Dentistry in Hampton. And I get asked a lot of questions about dentures, so I'm here to answer those questions for you. One of the common questions that I do get asked is, what are dentures? So, what are dentures? Dentures are an option for replacing missing teeth. It could be replacing a one single tooth or could be multiple teeth. And denture is a replacement option which comes in and out. Patient is able to put it in the mouth and take it out. Another question I do get asked is, what kind of a dental professional do I see to get dentures? So there are two types of professionals that you could see to get a denture. It varies upon the state. So the main professional that you will see for getting a denture is a dentist or general dentist. Other professional you could see what is called a denturist, but not many states in the United States actually have that professional. So your main source, main person, main professional to go to getting a denture would be a general dentist. Another question that I do get asked is, when can a dentist recommend me a denture? So your dentist could recommend you a denture when you're missing single tooth or multiple teeth. So most of the time in today's day and age, patients do want replacement option, which is a fixed replacement option. Denture is a replacement option when it comes out. It's a removable appliance, so patients can take in and take out, and they can put it in their mouth. So typically, the denture will be recommended when you are not a candidate for a fixed option. And it could be that you're medically not a candidate, or sometimes patients are not able to financially afford that option. So your dentist might recommend you that option for replacement of your teeth. So at least there will be some compromises, but you still have replacement of the teeth. Another question that I do get asked is, what material is used for dentures? So most of the dentures typically are made of resin acrylic, and it sets in, and it could look like just as your tissue, mostly looking like pink. Sometimes we can vary the colors of it, but typically the material is acrylic resin. Another question that I do get asked is getting dentures painful? The answer is, getting dentures is not painful. It's a multi-step process, but we basically are measuring the gums, taking impressions, taking the mold. A lot of times nowadays, we don't even use those mold systems. We are basically scanning you, so it's a painless process. Another question that I do get asked is, will having dentures affect my ability to eat or drink normally? Actually, the answer is yes, because denture is a replacement option. It is just sitting on your tissues. So there is some movement most of the times in patients when they're eating, or less with drinking, but mostly with eating. So there's a compromise that is kind of made, that there are certain kind of foods patients are not able to chew and enjoy because denture does tend to move. For some patients, if they have a good bone, good retention of the denture, they are typically okay with it. But most of the patients, they do report that they are not able to chew as they were able to chew and enjoy the food when they had their own natural teeth. Another question that I do get asked is, what is the best way to clean and care for my denture? Really great question, because we want to make sure that your denture is clean and well cared for, so patient does not get any irritation on the tissues. So the best way to care for it is making sure that you're taking the denture out at night. You want to get a small box. Typically, your dentist will provide you with that small container, and you're going to take your denture out. Typically, we recommend that using a different brush and gently brush off the surface. There are denture cleansing tablets, denture cleansing solutions that you can use, that you can sometimes soak the denture as well too overnight, and then you can clean it out, rinse it out in the morning, put it back in your mouth. Very important that your denture is out every night, and you can, again, like you can just simply use a regular toothbrush, put it under the water and rinse it out. You can use soap and water, and you can also use denture cleansing tablets or solutions as well too. Another question that I do get asked is, how long will my dentures last? So typically a denture can last anywhere from 10 to 15 years, in some cases from 7 to 15 years. So you want to make sure that you're caring for your denture really, really well. And if your denture is starting to break or starting to seeing any kind of creating an irritation, make sure you report that to your dentist so it could be repaired. or make sure there are no sharp edges so that your tissue is not irritated. So typically, so the length of the lasting for the denture would be anywhere from 7 to 20 years. Another question that I do get asked is, what do I do if my denture needs a repair or a replacement? Great question. So you want to, if you're finding the need that you're feeling your denture is either breaking or you're seeing any sharp points on your denture, it's rough, or if it's broken, so you want to make sure you give your dentist a call right away, schedule an appointment so they can evaluate the denture. Your dentist will evaluate and see if this denture is still in a state that it can last you, it can be repaired. Certain kind of fractures or if there's a roughness, that could be repaired, but at certain point in time, the denture needs to be replaced. If it's too rough, it's been old, it's worn out, your dentist will recommend replacing of the denture. Hope I was able to answer most of your questions regarding dentures. If you still have any questions or you would like to see us, please feel free to visit our website www.smilesbythecnh.com and give us a call at 603-926-8827 to schedule an appointment, and we will be happy to help you.